Ketosis could save your life, or perhaps the life of someone you care about. Ketosis makes weight loss diets that work possible, and the weight loss can put type 2 diabetes into remission and can help control high blood pressure. Ketosis can help control epilepsy. It was first used in the year 500 BC, introduced into modern medicine in the 1920s, and is still used. Ketosis is now said to help treat Parkinson's disease, motor neuron disease, also known as Lou Gehrig disease or ALS, and now even Alzheimer's is said to respond to ketosis. Ketones may actually stop cancers. Are you raising money for cancer research? Cancer costs a lot of money to treat. Brain cancers cost the most to treat, an average of more than $108,000 for the first year after a diagnosis in women, and more than $115,000 for men. And these are according to the American National Cancer Institute. By contrast, treating melanoma, which is a skin cancer, costs an average of $5,000 for women and $5,400 for men in the first year after diagnosis. These figures include the total cost of treatment, not just the drugs. The cost of cancer drugs can range from as little as $100 a month to as much as $65,000 a month for some newer medications, according to the Memorial Sloan Kettering Cancer Center. Yes, your contributions are going to help, but there's a lot of money needed. In England, where much of the treatment cost is picked up by the National Health Service, Macmillan Cancer, their new research talks about the sheer scale of the financial burden faced by people who are living with cancer. 83% of the people on average are almost 600 pounds a month worse off as a result of a cancer diagnosis, because their income goes down and expenditure goes up, and this is a time when money should be the last thing on people's minds. If ketosis can really do these things, the amount of money you raise can have a much more important contribution to the care and the treatment of people with cancer. Because ketosis is possible to achieve at a cost that's around the same amount of money that you would normally spend on food. And we know that ketones do many of these things because ketogenic weight loss diets lower blood pressure and can put type 2 diabetes into remission. There's plenty of proof for this. And ketogenic diets are still very much in current medical use for the treatment of epilepsy. Can it really treat cancer? A great many prominent doctors and scientists think ketones can help treat cancer. And they believe this because the idea is based upon some very, very good science. And there is now considerable laboratory and clinical evidence that it really works. So with all the people suffering with cancer and all the people trying to treat cancer, why is ketosis not more widely used in standard treatment? We think we know, and we're attempting to do something about it. We've been working with a weight loss approach for nearly 40 years. The program is much more effective if the dieter gets into ketosis. And getting into ketosis with normal foods is difficult, but staying in ketosis is even harder, and most people don't succeed. Our diet formulas do succeed. This is a typical weight loss graph. and it's proof that we can reliably get prolonged ketosis. This person was in ketosis for over 6 months. If the ketosis had been interfered with by cheating, and at any time in that 6 month period, there would have been a refeeding edema. There would have been a lot of fluid that would have been put on quickly, and you would see a big blip in the weight. But as you can see, over all of this time, the weight loss was continuous, and therefore ketosis really was sustained at a 6 month period. And for cancer, we believe that the weight loss diets are too low in calories. Since many people are in the late stage of cancer, they're seriously thin and wasted. They've got cachexia. And we don't want them losing more weight. We also believe that production of ketosis for cancer sufferers must happen quicker and be more certain than that for weight loss. So we've produced a new formula specifically for the purpose. We now need your help. We need to test it and prove that ketosis can really improve cancer survival. So we need your help with two things. We need some volunteers with cancer to use our new formula. And we need to raise some money so that we can get PET scans and prove that there really was a change in the cancer in a short period of time. We can't wait for years to see what the survival will be. We've got to be able to get results quickly enough so that we can show that this really works. Please join our campaign. Your help could really prolong the life of someone you care about. And it could happen in this year.